Hello, my name is Renata Cadena.
And I'm Samuel Tinoco, and we're from J. Frank Dobie High School.
Today we will be discussing our project titled Mental Health Advocacy. Our goal is to focus on mental health, its importance, how it affects the teenagers of Generation Z, and why it should be validated as excused absences within the Texas School Education Association and other related parties. We would also like Texas school districts to add mental health centers that will be available for students year-round.
By this, we form a plan by creating a portfolio to share information about our research and proposals. We inform FCCLA members, Pasadena ISD and district personnel, Texas Education Agency personnel, and social media audience in Pasadena, Texas, Houston, Texas, and the state of Texas. We also research district and state policies on absences related to the mental health, conduct a survey related to mental health in adolescents, partner with staff and authorized personnel, and our resources were the TEA website, Texas School Safety Center website, Pasadena ISD district website, local high schools, FCCLA advisors, Pasadena ISD teachers and staff, and Pasadena ISD students' personnel experience.
Part of our act is to research and compile information from the websites we selected, including the World Health Organization and the National Institute of Mental Health. We also got the opportunity to talk to a real psychologist that gave us input into what kind of questions we should put on our survey, and as well as our school assistant principals on how they handle mental health and absences related to such, which is different from the other schools in our district because Dobie High School, it has them as excused absences, while the other Pasadena ISD high schools do not. So to get started, we first have to define mental health and what it is. And according to the World Health Organization, mental health is a state of well-being in which the individual realizes his or her own ability, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community.
Now that we know what mental health is, what is good mental health? Well, according to our survey that we distributed through our school, good mental health doesn't have an exact definition. Some students from our high school said that having a good mental health is being able to maintain a good state of mind while under a lot of pressure and stress. But one person who truly caught our eyes with this survey said, being mentally healthy means to not worry about anything related to school life and enjoying life as a teenager.
So to explain why this caught our eye, they put mentally healthy in quotes, as you can see, as if it really wasn't a plausible thing for a teenager to have. So with that, do we as high school students need to sacrifice our time and livelihood to slave away in textbooks and rush into adulthood? So with this being our prevailing question, we wanted to see if poor mental health really was leading with Generation Z. We searched the web and stumbled upon the World Health Organization and their documents for adolescent health. We then found out all the facts that establish why it is so important for the education system to consider mental health in the curriculum, make it valid absences, and provide mental health days where we learn coping mechanisms and how to manage these feelings.
According to the WHO, 1 in 6 people ages 10 through 19 suffer from poor mental health and mental illnesses. And that, with being said, most of these illnesses do go undiagnosed and untreated. With this information in mind, we relate back to our survey and statistics from our backyard. And 42% of our students from a survey of 105 students said that they were not mentally healthy. That is 44 students. And with that, 36% of people said that they were not really sure if they are mentally healthy, which is another 38 students, which leaves 22 students who said they are mentally healthy.
To go more on what the World Health Organization they also stated that suicide is the third leading cause of death from people ages of 15 through 19. So considering this information, we decided to ask the students, have you ever had any suicidal thoughts, depression, anxiety, or any other related feelings? The numbers that were produced from this question was shocking. 71 students from our school have felt these feelings.
That is 71 lives that could have been lost at any moment.
71 lives that could be saved if we just added a mental health curriculum into schools and allowed for mental health days and centers to be established within the Texas Education Association.
And specifically, the Pasadena ISD district. Most of these students didn't even know they had these feelings. Most of them then gain these thoughts during their high school years. Directly from our survey, 47% of students have never had these feelings before high school. That is 49 people who are new to these emotions and lack the skills to handle them, which then ends up damaging them more. 39% of students said they did have these feelings before high school, but augmented throughout their high school years.
Students are overwhelmed and exhausted. We push ourselves to the limit while having so much on our plate. We become emotionally and physically drained, yet we still have to keep going.
We as students give up a lot to be as great as we are, but what is the cost of that? Because of this, we decided to ask students to describe how school makes them feel in one word, and most responses were negative. We saw tired, exhausted, stupid, drained, and pointless, and other descriptors along that line. We even saw students say it was like everyone was constantly expecting greatness from us, and we were delivering it, but it cost me a lot. What is school costing us as students? Yes, it is giving us a chance at a better future, but what is the cost of delivering that?
So you may be wondering why we gathered this information, but haven't tied it to our policy nor the specific change we're focused on. We needed our audience to understand the importance and the impact school has on mental health. The Texas Education Association isn't aware of this problem. With the TEA code of 25.087B, Section 2, stating that a school district must excuse a temporary absence for the purpose of an appointment with a healthcare professional. A healthcare professional is what we consider doctors and surgeons as, but it does not say a mental health care professional, which are completely different angles to well being.
As a result of our mental health advocacy project, other area high schools in our district are looking into how our campus handles mental health days for students. We learned that how come other high schools in Pasadena ISD do not implement these changes, but our high school does. We see this as very unfair for the other students in the district that we share and learn from.
DA needs to be up to date with these students that are passing through their schools. Mental health is a rising issue with teenagers, and policies should be updated as such. Students tend to live more in their head and worry about the social norms of life than enjoying it, and schools are a huge part of this.
And that concludes our presentation, and now we're on to our validated questions. For the first question, we we have improved our understanding on how the education system works under this code and how to treat students when these absences do happen. We find it to be unfair where the system would not listen to their students once the words mental health appears. Instead, they are thrown back into the worksheets after worksheets with little to no help from teachers and even the higher administration.
And just to answer the second question, we faced the challenge of reaching out to our partnerships that were included in this presentation, the psychologists, the assistant principals, higher personnel and administration within the PISD district. How we found the solution to this is that we just emailed back and forth, and each and one of us went on separate meetings with different people so we could knock out different people at the same time. And just another one was all the crazy Texas weather, which really prevented us from submitting our things and getting a lot of our information processed. But that's it for our presentation. Thank you so much.